Welcome to this episode of Jing TV, where we get to talk about myofascial release and trigger point therapy. Welcome back to Jing TV. I'm Megan.
I'm Rachel.
And we're the directors of the Jing Institute, where we work with a lot of different massage techniques. But in particular, we thought we would highlight a bit about myofascial release and trigger point
They're our
therapy.
top two favourites, really,
They
aren't
really
they?
are.
I think they really are the bread and butter of our practice.
Yeah, but I really like stones too.
Yeah,
Anyway.
that's true. All right.
Okay, so first we thought we might talk about trigger points, because that is actually the technique that we feel like both of us, even though we came to massage differently, made us more efficient massage therapists. So, Rachel, tell them what is a trigger point?
So trigger point is basically a very small contraction in a muscle. So it's where the muscle fibers have got very, very contracted on a micro level. So you will be able to feel it as a body worker, and it will cause referred pain. So that's the big thing about trigger points, is they cause pain not only around the area but also in a predictable pattern. And it's based on the work of Janet Travell, who we love, who was the physician to President Kennedy, and she wrote these amazing books with David Simons, which basically maps all the trigger point referral patterns in the body. Not that I can find one now, but I will. So there's a good one, for example. So the trapezius, is that trapezius?
It is.
So a trigger point in the upper trapezius can cause pain up and around the head. So your client might be coming in with a headache, but the problem is actually coming from a trigger point in the trapezius.
So that was a huge revelation for me as a therapist. It was like, okay, the pain is actually coming from a different source. So trigger points and their maps that Travell laid out for us made us really efficient. I think what's been interesting to me in teaching at the Institute over time is actually, although we haven't invented trigger points by any means, we treat them very differently. So instead of some of the classic texts, which is when you find a trigger point, you're holding it to the kind of level of excruciating pain for 2 minutes. We're not really about that. And I think that goes back to us being, one, concerned about the therapist, and two, not causing pain. So instead of holding it up to 2 minutes, we're really advocating that you would hold a trigger point for 8 to 12 seconds. Ask the client what level of pain they're feeling, so never going above a subjective number 7. And that if it is the primary trigger point, or what's now called the
key trigger point.
Point.
The correct new terminology.
That if that's what you've identified, that you just go back to it 2 or 3 times per session, and then again back to 1 to 6 sessions for that. So that gives you a bit more of a guideline around trigger point therapy. And how do you find them?
So I think the other key thing is to treat all the muscles around the joint for trigger points as well. And we often find that people have been trained in trigger point therapy, but they're not really getting results with it. And I think the reason that at the Institute, why ourselves and our students get good results, is because we teach them to be very precise on their palpation skills in terms of finding them, and also to treat all the muscles around the joint. So just because someone's got a low back pain that looks like the quadratus lumborum referral pattern, don't just treat the QL, treat erectors, glutes.
And we're really not a fan of people are starting to stick needles in them without any other palpation, because actually, although Travell marked little X's, they're not always exactly there. You have to palpate the whole muscle, either by scanning, going through the length of the tissue, or a pincer grasp. So jumping next to another huge topic, which is myofascial release, I think it's important to point out to begin with that Travell actually called her books Myofascial Pain and Dysfunction, the Trigger Point Manual. So in the beginning they were very connected, and now they've been separated.
Those books, actually, the reprint of those books talks about how myofascial release is an effective way of treating trigger points.
Oh, it's awesome.
Well.
Yeah,
so there you go.
So myofascial release, you've been doing it for how many years?
Oh my God, long time. 1995 I think I started doing this. Oh my God, getting on for 20 years, not quite, 18. And it's quite interesting with fascia, because it's become like really, it's hot hot at the moment, isn't
very
it? Fascia
hot.
is so hot. I think the number of research articles on fascia has gone like that over the last 5-10
and
years.
the fascial research conference,
yes, which is a great thing that you should definitely go to the next time it's on. So there's been a lot of increasing research in fascia and its effect in pain and body mechanics, that kind of thing. Great guy Robert Schleip is at the forefront of a lot of that research, and he's interesting because he used to be a body worker.
Yeah.
So what is fascia?
So fascia we know to be the connective tissue of the body, and even in poor anatomy text, you kind of get that white. And that is really what fascia is. It's continuous, so it goes to the whole body, and it goes down to the cellular level. And it becomes really essential for the treatment of pain, because if fascia tightens in a particular area, then it can cause pain or decrease the range of motion. And in fact, my sweater can be very helpful. Whereas if I make a little bit of a fascial adhesion here, you could see that it might pull on the shoulder and cause pain there.
And fascia is quite interesting. I'm sure we'll talk about it in other episodes, because we used to think that the way that fascia released was that the tissue actually stretched, but some of the work of Schleip and other researchers is showing that that's not actually the case. So there's still a lot of debate about what's actually going on. What we do know is it gets results. It gets great results in clinic. If you're doing fascia work, do it without oil and do it before your trigger point work, very definitely. If you're interested in learning fascia work or trigger point work, we have tons of courses at Jing that address this. Your first point of call is always our 3-day foundation course, taught several times throughout the year in Brighton, also London and Edinburgh, and led by myself and Meg. So if you want to come and see us, sit on the Jing TV couch personally, come and join us on that course. That teaches you fascial techniques, trigger points, stretching, and some great Eastern
And then you designed a fantastic 9-day myofascial certificate, which involves both indirect and direct myofascial techniques.
Yeah, so over a 9-day period, working in 3-3-day modules, you get to learn all the major ways of working with fascia, which I've been studying and trying out in my clinic for years. So it's a really good all-round approach.
So you can find that all at www.jingmassage.com, where it says courses. And also on the online, we have a download of both trigger point therapy and myofascial release.
Yeah. And the low back online course, obviously, we teach the fascial techniques and the trigger point work for working with low back pain. You can also follow us on Twitter, Facebook, and subscribe to our iTunes channel. So, love to hear your thoughts on it.